Hello, my name is Moise. We were doing discussion group project research on the team steps. So my role in this group was to do Sbar. Sbar is pretty nice tool which we use every day in our care and any change of shift, any communication from doctor to nurses, from nurses to nurses, pharmacists to nurses. It's really nice to. It was actually introduced in the army and also which enhanced their communication. As we know, the army really communication. Once you're in the army on different mission, communication is something important which you should be putting in consideration. So SBAR it's an abbreviation which means S for situation, B for background, A for assessment, and R for recommendation. It is the structured communication framework used in all healthcare systems. It is a standardized critical information exchange among healthcare fields. It reduces communication and enhances teamwork and patient safety. There are a couple significance of Sbar which include but not limited to improves clarity and efficiency among the communication, reduces medical errors and sentinel events. It promotes interdisciplinary collaboration. It is used across all healthcare settings, e.g. in ED, ICU, and even for us in med-surg unit. Sbar is something which we use in our everyday life. We had a common scenario, 87-year-old female with past medical history of CHF, follows AFib, who takes a request. She presented to the ED with altered mental status, shortness of breath on exhaustion, weakness. So in ED, she was found to be in AFib RVR, chest X-ray showed pleural effusion and UA, and tested positive for UTI. Currently, she is on 2 liters nasal cannula, but her baseline is room air. A patient will be admitted to the med-surg unit for IV antibiotics, RES6, and new demand of oxygen, and PTOT consulted for evaluation, and we want to see their recommendation. So this is case scenario which we have, and as my part in Sbar, we have to break it down into small pieces which we can digest easily. So situation, we see that what is situation? What are we currently dealing with? We are dealing with 87-year-old female. She is 87 and she's now AFib RVR with pleural effusion, and now she's on 2 liters nasal cannula. She had and witnessed for. So those are the situation we are currently dealing with. So after presenting the situation, then you have to look what is her background, what things do we have to know in order to help this patient accordingly. She has a history of CHF, history of AFib, that's why she now takes ERQUES. Chest X-ray showed pleural effusion. UA tested positive for UTI, meaning UA like urinary analysis tested positive for UTI. So that is like couple background we have to break into small chunks. Now on the assessment, what are we seeing clinically? She looks unstable. She's weak. She's high fall risk due to weakness. She has diminished breath sound and some crackles or oxidation. So now if we are done there, what is our recommendation? So as we see, now we have to evaluate and control the heart rate. She's in AFib, AVR. The recommendation will be to keep monitoring her heart rate. Consider their risks. Give medication like RES6. Also assess for injuries which she had and witness for. So you have to assess injuries by doing CT scan of the head to make sure, since she's on blood thinners, to make sure she's not breathing internally. Maybe like she may have many problems when you fall and then you start to breathe internally, maybe hematomas, things like that. So we have to make sure we assess all the four injury. Did she sustain some injury, or there is no injuries? So we can't tell unless you have to do some exams which may look deeper than our eyes can see. And since she has UTI, we have to continue giving antibiotics to make sure and keep reorienting the patient. If she's confused, then we keep reorienting the patient and to reason with the current situation. So that was my part in Sbar. All the group has been amazing, and yeah, it was really nice interaction. Everybody's taking small part. It was pretty good, and I enjoyed. Thank you.